Welcome back to Barton Community College EMS Education. I'm Nick Larmer, your instructor for the EMT class, and this is going to be going over PR7, Medical, Legal, and Ethics, preparing you for that Module 1 exam and future exams. And so we're going to discuss these 1 through 10 listing of what is express consent and what is abandonment and false imprisonment, these different things. But I first want to give you a general overview of the chapter. So scope of practice. What is scope of practice? Well, scope of practice is what your scope is. What are your limitations? What are you able to do? These are your skills and procedures. Now, standard of care is what you are expected to do in your level every single time. So your scope of practice can be determined by the national, state, local laws, statutes, and then your protocols at the individual service. And we can limit it, or we can go straight down from what national standards say. And that's scope of practice. Now, your standard of care is the care expected from an EMT with similar training in another area for that patient in a similar situation. These standards reduce legal action. So the best way to remember scope of practice and standard of care. Scope of practice is what you can do, and standard of care is how you should do it. Consent. We're going to talk for the next 4 questions about consent. Consent is permission, and it is permission from the patient to assess, treat, and transport. We have to get permission from them to assess them, we got to get permission from them to treat them, and we got to get permission from them to transport them. So what is express consent? That is informed. We inform them of their decision, they say, yep, go ahead. Or they go ahead and they extend their arm, and we understand that they are expressing their consent. It's either them saying yep, or they're showing a body language of a voluntary movement of let's go ahead and do this. So in an advanced level provider, I'm going to start an IV, and they stick their arm out to start an IV. That's express consent. Implied consent is assumed, and it follows the laws and protocols of the area. So number 3, talking about implied consent, that would be with someone who is unresponsive or a child. That is implied consent. You would want the parent to have you treat the child if their arm had a severe laceration and they're getting and they have bleed and they're bleeding out, and so the parent would want you to treat that child. Children and mentally incompetent adults, those are minors. You have to make sure that you obtain that information from the parent or legal guardian. And remember, there are some possible exceptions that you don't have to obtain consent from an adult or another guardian, and that's emancipated minors, life-threatening illnesses or injuries, or minors who have children, or minors serving in the armed forces. Involuntary consent. Involuntary consent basically is if you're a threat to yourself or another, and you're basically taken into custody. That is through court order, or usually requires a mental health evaluation. A police officer or law enforcement officer is usually involved. But don't risk your legal liability just for involuntary consent. Informed consent is when someone says, yes, let's do this, and they have all the information to make that decision. We've talked about what a definition of a minor is a little bit, but a definition of a minor is pretty much anybody under the age of 18, unless there is those few that we discussed prior. And whose permission do you need? You need a parent or guardian, someone over the age of 18 who is in charge of that person. When should you use medical restraints or physical restraints is when a patient is a threat to themselves or others. And, when we talk about threats, we're talking a threat to personal safety. If someone's taking a swing at me and they need to be transported to the hospital, we're going to use some restraints. What is abandonment in regards to EMS? Abandonment in regards to EMS basically is when we say for that patient, we drop them off at the emergency room, or we drop them off at a certain situation, in another area, and then we shouldn't have done that. For instance, we drop them off in the ER and we didn't do transfer of care to someone of our level or higher, like an RN. That is abandonment. We're leaving them and we're abandoning that patient. False imprisonment is putting someone in the back of the ambulance who did not want to go. That's false imprisonment. We're taking them against their will. And what is the difference between assault and battery? Well, the difference between assault Assault has nothing to do with a salt shaker or a pepper shaker. Assault is when you're threatening someone. Battery is when you hit them. So think of those two things. Assault is when you say, I'm going to hit you. Battery is when you actually do it. So those are your two differences between assault and battery. Now, how that all happens, whether it's physical, battery is basically your physical section, and then assault is your verbal. Okay, just think about those two differences. So this is just a rundown of the medical legal ethics, getting you ready for that Module 1 exam. So what is confidentiality? Confidentiality is information about patient's history, condition, or treatment, and that is usually considered confidential. And we had something come into place in the late 90s, early 2000s called HIPAA. And HIPAA is the Health Insurance Portability and Accountability Act. And how does this deal with confidentiality and accountability? This basically means information that pertains to the patient, address, their date of birth, their name, things that could set them and say that's who that is confidential and should only be shared in the chain of custody or the chain of care. So if you're passing off care to an RN, they'll know the information about the patient. But if you go talk to Joe Blow on the street, don't worry about telling them about HIPAA because you can't. That is part of that privacy rule of the HIPAA. There are two forms of confidentiality that we need to talk about when it is a breach, and that's slander and libel. Libel, I always like to remember, where would you go read a book? In a library. And that is the written word. So libel pertains to the written word, and that is when you breach confidentiality with something like libel. Slander is like speak. So that's where you breach confidentiality by speaking. So if you slander somebody, it's either saying something mean about them or not true, or breaching that confidentiality. That'd be slander. And then libel is where you do that through the written. And that's your difference. A DNR is do not resuscitate, and these are usually written to have to be signed by a physician and the family for an individual on a resuscitation order, bringing them back with CPR and excessive measures, and that is a DNR. And that usually has to be in place for us to not do resuscitation. A living will is what someone puts in place on what they want to be done for them in the place that they can't make decisions for themselves anymore. And that's a living will. A durable power of attorney, number 15, a durable power of attorney is someone who is put in place to make that decision for the individual and to enact that living will and to make sure those things are happening and make decisions for them when they can't make decisions anymore. So the difference between a living will and a DNR, living wills are just everything, and DNRs are dealing with resuscitation. Different types of mandatory reporting. We have different things that we have to make sure that we're doing mandatory reporting on. Abuse, child, elderly, or domestic abuse, dog bites, violence involving gunshot wounds or stabbings, sexual assault, use of restraints, intoxicated persons, and mentally incompetent people are special reporting requirements and usually are part of our mandated reporting. Definition of values. The definition of values is a person's principles or standards of behavior, one's judgment of what is important in life. That is what you choose is your values. My values is I love making podcasts. And so that's what I choose to be a standard in my life, that I value podcasts. It's whatever you value, you put worth into, is your values. Ethics is what you basically say is the right and wrong depending on the situation. Morals is what you basically say in life is your moral values is right versus wrong. We say it's not right to kill someone. That is the moral value. Or more specifically, it's not right to murder someone. That right versus wrong. Ethics is in a particular situation the right versus wrong way to approach it. Ethically, in some situations, it is right in some people's eyes to do a certain way or to perform a certain act in some situations where it's not right in another, and that's ethics. And then the final question here, how do you preserve evidence during a sexual assault? Well, number one, if the individual, we got to preserve evidence on the individual. So don't allow them to go take a shower. Don't allow them to go clean up, even as much as it sucks that we would like them to be able to clean up from the incident that they've been in. And we want to make sure that we preserve all evidence. If you've got to cut off clothing, if there's rips and tears in the clothing, preserve that, cut away from that. And if there's clothing that we need to preserve, we want to make sure that we put that into a paper bag so that if it absorbs any fluids, the DNA can still be taken from the paper, whereas if we put it in plastic, that starts to interact with chemical reactions with plastic and the fluids, and it doesn't work as well, and we start getting some evaporation, condensation, and starts mixing with that DNA. So paper bag, make sure to not allow them to shower or go to the bathroom, not allow them to clean up, and then try to stay away from talking about the sexual assault case while you're going to the hospital. Just maintain taking care of that person with efficient, compassionate care. In the next section, we're going to be talking about anatomy and physiology, preparing for this module exam. So go ahead and stay tuned for that, and we're going to talk about this with the EMS education.